Mr. Johnson, it's important that we talk again about you having access surgery.
Well, remind me, what will the access surgery do to benefit me?
By having a fistula inserted, it will ensure that you're able to get the best treatment possible, and you will be able to eliminate the need for a pesky catheter. Catheters are breeding grounds for infection. The last thing we need is to have you hospitalized because of an infection. The catheter you're using for your dialysis treatments could cause very serious infections, including some so severe they become life-threatening.
I don't know. I'm nervous to have another surgery. I'm not sure I'm up for it. I just have so much going on right now.
I understand. Keep in mind, this is an outpatient surgery. Most patients are sent home the same day as their procedure. I'm also going to recommend home health services to you. After the surgery, a home health nurse will be able to assist you and teach you how to care for your new fistula in the comfort of your own home.
Okay, will home health cost me anything?
Don't worry, Mr. Johnson. Home health services are a covered Medicare benefit and covered by most insurances.
Great, I appreciate your help. Thank you for taking time to explain all of this to me. I think I'll go ahead and have the surgery. It sounds like it will benefit me.
Mr. Johnson, you've made a good decision. Wait here. I'm going to go get Marilyn. She will help you set up an appointment with one of the access surgeons we refer to from this clinic. To help you with your aftercare, I will coordinate with the access surgeon's office to have Direct Med Health Services Home Health set up for you after your surgery.
Hello?
Hi, Erin. It's Marilyn calling from Dialysis West Clinic. I'm here with Mr. Johnson. He has finally decided to have access surgery. Can we set up an appointment for him to meet with Dr. B? I am also going to set up home health with Direct Med Health Services. They will contact you to set up his home health visits post-surgery.
Yeah, that's great. The representative from DirectMed has informed us that their nurses work with the patient in their home to make sure the access site does not get infected. They also train the patient how to listen to blood flow and tell them what they should and should not be lifting in the home after the surgery. I will schedule Mr. Johnson to meet with Dr. B one day next week.
That sounds perfect. Thanks, Erin.
Thank you, Marilyn. I feel more relaxed and at ease knowing that a nurse will be seeing me in my home after my surgery to teach me and my family on how to care for my new fistula.
Hi, Mr. Johnson. I'm Maria, your home health nurse.
Hi, I've been expecting you.
Dr. B's office noted that your access surgery went well. I see you're resting, which is exactly what we like you to do following your surgery. I'm here because we need to be sure we're keeping your access area clean and free from infection. I will be monitoring the blood flow in your access arm and will be teaching you and your wife how to do it as well. Mrs. Johnson, what are some things your husband does around the home that require lifting?
He helps take out the trash and carries in the groceries after we get back from the store.
Mr. Johnson, we're going to need you to not do those things for a short period of time. The doctor did a great job on the access surgery, and the last thing we want to do is have you lift something heavy and risk any complications by exerting yourself. I will be following up with you weekly to make sure things are going well. I will be showing you how to make sure your access site does not get infected, and I will teach you how to listen to the blood flow in your access arm. In addition to the post-surgery care, I also want to review your overall care as well. Let's look at your renal diet and how you are managing your medications. Let's see the things you are currently eating so we can make sure you're following the renal diet that's been provided to you by the dietitian at the dialysis clinic. Mrs. Johnson, can I see a copy of his most recent lab results? I also need to see all of the medications he is supposed to be taking.
Now that I've given you some instructions on how to care for your new fistula and overall healthcare plan, it's time for me to leave. I'll see you again next week. But remember, if you notice anything abnormal about your access site, or you're having difficulty hearing the blood flow in your access arm, call Direct Med Health Services at 312-642-5500. You can call that number anytime. Here is a folder with all of our information. Keep it someplace handy.
Okay, thank you.
Have you been following my instructions from last week?
Yes, I've been following all of your instructions. You've helped me so much. DirectMed has really taught me a lot about managing my new fistula and taking the time to look at my overall health.